webinar. So now I'm going to introduce our speaker. Our speaker is Cheryl Vericola. Dr. Vericola received her undergrad and doctor of pharmacy degree at UNC. She has more than 30 years experience as a registered pharmacist working in clinical pharmacy practice, administrative, and project management roles. Since 2018, she has served as the director of practice advancement for the North Carolina Association of Pharmacists, facilitating the coordination of statewide initiatives aimed to advance the role of pharmacists in our state. So now I'm going to go ahead and hand it over to Cheryl.
Thank you, Jennifer, and hello, everyone. Thank you so much for tuning in. What I will mention is that, I hope you're back with us here for this three-part series. As many of you know, if you joined us in October and November, we began this three-part series with talking about nicotine replacement therapy and the provisions that pharmacists had been given surrounding the use of that protocol. And then, of course, in August of this year, pharmacists were able to seek medical reimbursement for those services. And so part of our training since October has been to bring you information about that protocol, about service model development. And then we're kind of wrapping that up here in December with talking a little bit about Medicaid provider enrollment. Some of this is a recap from February with some new information that we've learned along the way, but really just talking more about making sure pharmacists are getting enrolled as OPR-like providers with North Carolina Medicaid, and then what some of the new billing essentials are. So hopefully we're going to be sharing some old information that you may already know, but also maybe some new information that you didn't know. Get us started tonight. I want to talk a little bit about our objectives or our core learning goals. First of all, I really want to talk a little bit about explaining the importance behind pharmacists actually enrolling and becoming an OPR-like provider with North Carolina Medicaid. We'll identify some of the key requirements and the documentation that you need to complete that provider enrollment. We're going to talk about some of the challenges that you may face as you walk through the enrollment process and how you can overcome those. Then we're going to describe some of the key considerations that you need to think about or understand when you're preparing to bill a medical claim across a North Carolina Medicaid plan. There's many plans, up to 10, and we're going to talk about those. And then I want to talk a little bit about what we know are some of the differences in the billing requirements. So to kind of cover that first objective, I want to talk a little bit about why it's so important for pharmacists to become OPR-like enrolled providers with Medicaid. And if you were to ask a Medicaid representative, more than likely what they would tell you is that Medicaid's take is that enrollment supports the use of the North Carolina Pharmacist statewide protocol. All of those provisions that we received opportunities to provide back in 2021 through our state legislation. So hormonal contraceptives, nicotine replacement, prenatal vitamins, PEP, glucagon. But also enrollment allows pharmacists to actually act as prescribers for Medicaid medical claims, which is something that we have not had the authority to do to date. It also allows pharmacists to be able to medically get reimbursed for providing those clinical services under those protocols, but also to get paid for the drugs that we dispense under those protocols. And then, of course, from a patient perspective, it's really all about increasing Medicaid members' access to essential medications. Pharmacists can play a huge role in this. And, we're talking about a very vulnerable population. So this is really a win-win for our patients. NCAP would piggyback on that and tell you that also pharmacist enrollment and medical billing gives you another alternative revenue stream that you can use to sort of counter these challenges that we've been facing for years now with PBM negative practices, especially those that are, creating low and even negative drug reimbursement. So it's an opportunity to have another revenue stream to build some return on investment. And then, of course, early adoption by pharmacists can also drive North Carolina Medicaid to think about paying us for additional services moving forward. So we want to make sure that we're embracing these opportunities. As you may well know, NCAP is always working on payment legislation, scope-related practice bills, and, bar none, we have opponents out there in the legislature, opponents that would argue that if we're slow to adopt any new authorities, then, why should we, be going after new authorities if we're so slow to adopt the ones that we currently have opportunity to provide? Not only that, but they'll also argue that any delays, that we should delay anything until we see benefits from our existing provisions. So we just want to kind of thwart all that, make sure that pharmacists understand that let's do this. Let's get enrolled. Let's start medically billing, and let's show others that what we can bring to the table. Where are we now? What I can share with you and what data that I have been able to get or glean from North Carolina Medicaid since last Wednesday is that we currently have 616 enrolled pharmacists that now have their OPR Light provider status. I think this is fantastic news. If I were to have shared this with you back in February when we did our last presentation on Medicaid billing, probably could have counted on one hand how many individuals were actually, pharmacists were actually enrolled. So now we have over 616, huge first step. When it comes to claims submission, not so much, right? We've only had one successful hormonal contraceptive claim billed to date, and of course we have none for nicotine replacement. But bear in mind that it's a stepwise approach. Rome was not built in a day. It takes getting pharmacists enrolled, getting them acclimated to the billing process, understanding the billing process for us to start to see some of the transition in improvement in claims, medical billing claims. So we're getting there. It's kind of a process, but we're getting there. So let's talk about OPR Light provider enrollment, because some of this we've already covered back in February, and so I'm going to skim over some of it, but I want you to understand what the enrollment must-haves are. So before you even sit down to enroll as a Medicaid provider, one of the things is that, first of all, you got to be a licensed pharmacist in North Carolina, right? No brainer. You also need to be an immunizing pharmacist, so you have to have that certification, that immunizer certification on file with the North Carolina Board of Pharmacy. You also need an individual NPI number. You need to access NC provider portal. You're going to need this for multiple reasons. But in order to do that, you have to have an individual NCID account in order to establish that access to NC. You also need to have professional liability insurance. So most of you probably have this. Getting your certificate of insurance or that document that shows you what your coverage limits are and maybe any other information you might be asked in the enrollment process, something you may want to have handy. And then, of course, there is a fee to applying as an OPR Light provider with Medicaid. That fee is $100. So you want to make sure that you have a credit card on file that you can have that electronic transaction. Now, before you enroll also, I would encourage you to check your North Carolina Board of Pharmacy profile. Sorry, hang on. And I say this because I want to make sure that you have confirmed that you have your pharmacist, vaccinator, or immunizer status checked appropriately. This is something that we have seen happen. First of all, you'll see the screenshot here with the licensing options. This is actually from a profile on the Board of Pharmacy's Licensure Gateway. So when you go into the Licensure Gateway, log into your profile, you want to look for the licensing options, and you want to make sure that your vaccinator status is current and is actually the status is correctly recorded. Now, each of these blocks, you'll notice, has a check mark in it. A check mark that is an icon. It is an image. It is not significant, nor does it indicate that you are actually a certified vaccinator. What does show that you are a certified vaccinator is the color of that box. So notice that the vaccinator status here that I've circled is green. Green indicates in the checkbox that shows active immunizer status. If the box is white, then that means the board has not registered your immunizer status. So you want to make sure you check this. And I say this because we've already had a situation where a pharmacist went to enroll. They mistook the fact that there were check boxes here as a means to say that they had their immunizer status recorded appropriately, and it was actually not checked green. So you want to make sure that color is green for under your licensing options. If you are not sure how to get to the licensure gateway, of course, I've provided that to check your status. I provided your link there. And then there's also a link to the question in the FAQ document on the Board of Pharmacy's website that actually shows you how to go in and update your licensing options so that you do get that box checked green appropriately. So step one, again, we talked about for provider enrollment also was that you had to have this individual NPI number. I would say probably for all intents and purposes, probably most pharmacists actually do have their NPI number. But if you don't, you do need to go to the National Plan and Provider Enumeration Systems website. I've given you the link here to enroll and create your NPI number. If you already have an individual NPI number, I still encourage you to go to the site. Again, check your profile, make sure all of your information in your NPI profile is correct and up to date. You also want to make sure that your NPI number is linked to this taxonomy number that we have listed in the slide, the 1835 pharmacist NPI. Medicaid requires that that NPI number be linked to your taxonomy code here to ensure that you get proper reimbursement for the medications as well as the clinical services if you're providing services for the hormonal contraceptives or the nicotine replacement therapy. Now, if you haven't checked your NPI number, again, too, I would say make sure it's up to date. Medicaid will also make comparisons with this data from the NPPES site with the details that you provide in your Medicaid application. And if there's any inconsistencies, then that would lead to a denial of your Medicaid application. For example, we've had situations where women who established their NPI number when they under their maiden name, and then they went to seek OPR-like provider status, and they were enrolling under their married name. That when that match or when that those records were cross-referenced, they could not make the matches appropriately. And so the pharmacist was denied until they could go back and make those changes. And then unfortunately, if they find themselves in that situation, then they have to go back and redo the application all over again. So you want to avoid that if you can. Step two, again, we talked about having that NCID account. The NCID account is necessary for you to access NT Tracks. You have to have access to NC Tracks, which is Medicaid's management system, simply to get to the provider enrollment form. But it's also going to become the system where you're going to turn to for claim submissions for hormonal contraceptives and NRT services if you're providing these services to an enrolled Medicaid member who is part of Medicaid Direct. I'll talk a little bit more about that moving forward, but just to request an NCID account, I've given you the link here. You can also go to the DHHS's Medicaid site where it says Getting Started with NC Tracks, and then you can click on the link from there and then go to create your account. New to setting up your NCID account is this need to set up enrollment with a two-factor authentication. I mentioned that for two reasons. One is that, first of all, there's a user guide. So if you need to establish this, the user guide's pretty simple. It's a couple of steps, no big deal. If you're establishing your NCID number for the first time, you're going to walk through this process anyway. They're going to ask you what form of ID you want to use as your secondary form. However, if you're someone who already had an NCID account and you set up that account before September 15th, this would not apply yet. Medicaid will actually notify you when you need to set up your two-factor authentication. So don't worry about it. If you were enrolled and had your NCID account before the 15th, you'll get email notification of when to update this. But if you are setting it up for the first time, then you'll walk through the process of setting it up when you initially create your NCID account. Once you have submitted that request, you'll receive an email confirmation. It'll have a link. It'll ask you certain additional setup instructions. Pretty simple. It's just a couple of steps. So you want to make sure you do that. This is time sensitive. So it only gives you 3 days to complete going to that link and setting up those or doing those final setup instructions. So you want to make sure you do this within 3 days. If you don't, you just have to start the process all over again. And then once you have your NCID account, you can use your user ID and the password that you established. You can log into the NC Tracks portal and you begin your OPR-like provider enrollment application. And you'll be looking for these icons. I've given you the link to the NC Tracks provider portal at the bottom. You just want to look for the NC Tracks secure portal login image. You click on that, you put in your password, your user ID, and then you should be able to see the image that says to begin the application process. Now, the third step is completing the enrollment application. And I'm not going to go through each step-by-step instruction for doing this. We did this back in February, but what I will tell you is that we have all this information available on our website. I've given you the link again at the bottom in our Navigating the Enrollment Process resource page. We also have a document that we worked with Medicaid to provide that is specific to pharmacists in completing the enrollment application. This was just released in June, so it came after our last training, but it really walks you through the steps for enrolling successfully. And so I would encourage you, when you're going through the process, have the enrollment application on one screen, have your guide on the other, and you should be able to go through without a misstep. I will leave you with the caveat that there are some questions in the application process that will cause a hard stop. And if they're answered incorrectly, it's going to prevent you from moving forward in the application. To avoid these, again, on our website, we've created a chart with all of the questions that create a hard stop. And then we've given what answers you need to put in there to avoid that hard stop. But I will tell you, whether you're using our website and using this chart, or whether you're using the guide that I just showed you on the previous slide, both of these have incorporated what those hard stops are in the steps. So again, if you're following the guides, you should be able to get through the process without a misstep. So either one is fine for you to use. Now, what do we expect after you complete your application submission? Well, first of all, for the enrollment piece, it could take up to 3 weeks for the final approval. And some of this is dependent on you, because Medicaid has to give you opportunity and time to complete an online provider training. This is required. It is legislatively mandated for all Medicaid enrolled providers. So it's not just pharmacists, it's doctors, it's anybody that's enrolling as a provider. It can take up to 90 minutes, although I have heard from pharmacists that have taken it that it really didn't take that long. It took maybe 60 minutes. You do have a completion deadline for this. Again, it's time sensitive. You have 14 days to complete it. Any exam failure or any failure to complete the training within the 14-day time window would result in the application being denied. Again, that would lead you to having to do the application all over again and pay the additional $100 again. So want to make sure we avoid that. Get your training done on time. Try to get it within that 14-day window. You're going to receive a lot of correspondence during this time. So once you've submitted that application, you'll get notification that you've submitted it. You'll get notification from Medicaid about the training. It'll give you the links to the site where you go to take the training, your login information, your passwords, what those requirements are. It'll give you your training completion notification. It'll give you your application completion. So once everything's in, you'll get a notification about that. Anything that is missing, any incomplete application submissions, and any need for additional documentation would come in the form of an email. And then, of course, ultimately, what we want to see is that you'll also receive that enrollment approval and your OPR Lite welcome letter. So where I'm going with all this and why I say this is so important is the take-home point is that just when you're filling out your enrollment application, make sure that you put an email address that you feel is really going to be accurate for receiving Medicaid-related correspondence. And then it's an email that you kind of frequently check so you can stay on top of these things, especially considering some of this is time sensitive. I have a cheat sheet. If you want access to this, you want to print it out. If it's helpful in any way, please feel free to use this. This just walks you through the steps with the links, what you need to have available in order to get through that whole process. You can also find this on our website. I've provided the link there as well in the slide. And then now once you've completed your enrollment, you're enrolled as a Medicaid OPR Lite provider, then what services can you bill for? We've already talked about this a little bit, but currently Medicaid provides reimbursement for both hormonal contraceptives and nicotine replacement. The hormonal contraceptives, of course, went into effect in January of this year. And then the nicotine replacement therapy went into effect in August. Now, to bill for these services, your pharmacy must fall under one of the following taxonomy codes. So the ones that are specific for clinic pharmacy, community or retail pharmacy, compounding or long-term care pharmacy. So if you work for any of these pharmacy types, if you will, then you are eligible to medically bill for both NRT and hormonal contraceptive services. Billing also requires that when you're submitting a professional claim that you have to use standard codes. Those codes that have been established by the Centers for Medicare and Medicaid Services have to be used. And those codes include things like the CPT codes, which are your current procedural terminology codes. We have two that we can currently bill for, a 99202, which is an evaluation management code for a new patient, and then a 99212, which is evaluation management for an established patient. So that which you would use for a patient that maybe is coming back in for monitoring or for follow-up. You also have to use these specific diagnosis codes. Most of these codes are specific to the service that's being provided. You can see what those applicable codes are here for both tobacco cessation or tobacco nicotine replacement therapy, as well as hormonal contraceptives. And then some of them may require modifier codes. Nicotine replacement does not have a modifier that you have to use, but there is one associated with hormonal contraceptives. So you want to make sure that you incorporate the family planning or the FP code when you're doing that medical billing. Now, all of this is important. You're going to need these codes available as you're entering a medical claim, whether it's electronic or by paper. Most forms you're going to do electronically. So you will need these codes in order to provide and do accurate and successful billing to get reimbursed. I think it's also important that you understand that these CPT codes that we talked about are time-based evaluations, so they're tied to timeframes for encounters, and that you also, pharmacists have to follow, or they have to follow certain documentation standards in order to ensure that you're prepared should you ever be audited by your payer. At a minimum, you should be recording the reason for the visit. This can include the primary reason for or the purpose of the visit, or what was addressed during the encounter. You want to make sure you include any pertinent facts, findings, or observations. This could be things that would be relevant to, say, screenings, filling out questionnaires, which we know is part of the hormonal contraceptive protocol. Vitals are also necessary. You have to record those as part of hormonal contraceptive services. You want to make sure that you have documented a plan of care detailing the service that you provided, any medications that you prescribed, any education that you provided, counseling, and or follow-up or monitoring that you discussed with the patient. When it comes to coding, the time spent delivering the services, that refers to the total time spent on the date of the encounter. Now, that can include both face-to-face time with the patient, but it can also include non-face-to-face activities. For the 99202 code, which represents the new patient encounter, that time documented should range somewhere between 15 and 29 minutes. And for the CPT code 99212, which was the established patient encounter or the follow-up visit, that requires a total time range of about 10 to 19 minutes. To give you a little bit further context, the reimbursement rates for these codes are as follows. You have $55.81 that pharmacists can get reimbursed for a new patient encounter, and then for the follow-up visit, you can get $32.50 for that. So that's important. I think this is a great opportunity for you to think about, the return on investment that you could get from these services. Again, particularly if you are creating a service model where you're proactively screening patients and assessing them for either their smoking status or their desire to become pregnant next year. If you're simply screening them to ask those questions, then you're likely to draw a larger number of patients that would be interested in smoking cessation or NRT, or patients that may be interested in contraceptives. So it gives you an opportunity to kind of engage with patients and increase that return on investment or that opportunity for billing. I talked a little bit about the fact that those codes or that time-based encounters could be both face-to-face and non-face-to-face activities. I just wanted to provide you some information from the American Medical Association's CPT code evaluation and management guidelines that kind of references for you what some face-to-face and non-face-to-face encounters or total time activities might look like. So I'm not going to go through all of them, but I did want to provide them here. And I've also provided you a link to that AMA document. So if there's ever a question about, hey, is my documentation counting in that time frame in delivering that new patient encounter? Yes. You can see from this that would be included. Any coordination of care, things like that would also be included. So now let's think about, we've discussed about how to enroll as a Medicaid provider. We talked about the services that we can bill for. So the next step is really to focus on the key considerations that we need to think about before we even begin to bill a medical claim. And I kind of group these into three main areas. One is to familiarize yourself and understand the different North Carolina Medicaid plans. As you know, back in 2021, Medicaid transformed 2/3 of its members to 5 commercial plans or managed care plans that were managed by private insurance companies. And in July of this year, we saw that same transformation happen with the launch of the 4 tailored plans. And these tailored plans oversee the Medicaid's behavioral health population. So we have a lot of plans to think about when it comes to medical billing. The next step, I think that's important, or the next key consideration, is to understand the available billing methods for each plan. So how do I process? What do I have to do in order to process a medical claim for a particular plan? And then what are the specific billing requirements or instructions for each of those plans? And I'm going to start with the first one. So when it comes to understanding Medicaid plans, recognize that Medicaid members, patrons, your patients, they could belong to one of 10 Medicaid plans. They could be part of North Carolina Medicaid Direct. They could be part of a managed care plan. And then you can think of this as being your managed care plans divided up into both standard plans and tailored plans. Now, I've listed your standard plans on the left. Your tailored plans are on the right. Standard plans provide both physical health, pharmacy, care management, basic behavioral health services, whereas your tailored plans provide the same services as standard plans, except they do it for an enhanced mental health population. So those with substance use disorder, those with intellectually or developmentally delayed, or those with traumatic brain injury. So they're kind of divided up according to that. We have 4 tailored plans: Alliance, Partners Health, Trillium, and then BIA. I think it's interesting to note with the tailored plans is that they are county specific. There is only one tailored plan per county, and then a member is assigned to a tailored plan based on the county that manages that patient's benefit. Now, why is this important? Why do I even bring this up? Because when we think of overarching, we've got 10 Medicaid plans, and we're, maybe getting a little squirrely about, oh my gosh, I've got to learn how to bill for 10 different Medicaid plans. Maybe not. For the tailored plans, you may only need to focus on addressing the billing method for the plan that is part of your area. So if you're a pharmacy that is located in Trillium's catchment area, then maybe you just need to familiarize yourself up front with how to bill a Trillium patient. If you're in Alliance's catchment area, same thing. Maybe you just kind of focus on learning what you need to do in order to bill Alliance patients. Now, I'm not going to say never that you might have some crossover for a patient that is part of Alliance that may fall into a Trillium county, but it's probably going to be very few and far between that you see that. So it does give you kind of an option to narrow or filter down, who do I need to learn the most about when it comes to medical billing when it's a tailored plan. And then understanding those billing methodologies. So this is the answer to the number one question that most pharmacists have. And that is that, and I've heard this already, is that, wow, hey, if I'm providing hormonal contraceptive services, if I'm doing nicotine replacement therapy for a Medicaid member under the statewide protocol, where in the world do I go to electronically submit a medical claim for that member's specific plan? How do I know where to go? Well, we've kind of alluded to, I look at this in 3 different areas. It's either going to be NC Tracks, it's going to be perhaps an EDI clearinghouse, which I'll talk about in a minute, or you may need to go to the individual plan's provider portal to submit that claim. Now, NC Tracks, we know, I've already said this, is that if you have a patient that's enrolled in Medicaid Direct, you're going to use NC Tracks to bill that claim. EDI clearinghouses, and Availity Essentials is one of those EDI clearinghouses that I'm going to talk about. These are, kind of think of these as middlemen. These guys are third-party service providers that help to bridge the gap between providers and payers to help streamline the process of electronic claims and medical reimbursement. And then you also have some plans require that you go directly through their individual portal to bill. So let's talk about those for just a minute. And I'm going to talk about the specific billing options under NC Tracks. So we've talked about NC Tracks. It's a primary portal for pharmacists. Every pharmacist that is OPR Lite enrolled is going to have access to NC Tracks because you had to develop your access just to get to the OPR Lite provider enrollment form. So you have access to NC Tracks. From there, NC Tracks is your primary portal for you to verify patient information. So you can identify the plan the patient belongs to, as well as confirm their current eligibility. But again, it's also the portal where you go to bill for a North Carolina Medicaid direct enrollee. Now, I'm not going to walk through the steps on the specific billing of a claim, but I will tell you that, again, we have a very, very nice guideline that will walk you through step by step exactly how to bill a professional claim for a Medicaid direct enrollee. It is on our website. I've got it linked here. So when you do get to that level where you are ready to bill and you have a Medicaid direct enrollee, this is how you would do it. Make sure you follow these steps. And then we have those EDI clearinghouses. Again, they are a billing solution. They serve as a go-between between providers and payers to help you streamline the medical billing process. Availity Essentials, and the reason why I mention this is they are a particular EDI clearinghouse, and one that we know currently is used by several of the standard plans and several of the tailored plans for claims processing. So think of this as a multi-payer portal. If you have access to Availity Essentials, then you actually have the ability to go in and bill a medical claim for any of the standard plan and tailored plan enrollees. So for the standard plans, the plans that use Availity are Healthy Blue and C and Carolina Complete Health. For the tailored plans, Partners Health Management and Trillium use Availity. It does require that pharmacists set up an account, very similar to how you had to establish an NCID account to get NC Tracks access. Pharmacists also have to set up an Availity account to get Availity's portal access. Not hard at all. It's very simple. We have a cheat sheet for you here. Essentially, you go to the Availity's website, you select Essentials Login, which is going to be in the upper right-hand corner of the homepage. You confirm a couple of security questions to identify yourself. You click Create Account. Then you go to your inbox. It will send you a confirmation email with another link for you to complete those setup instructions. You're going to set up a two-factor authentication, secondary form of ID, click your user agreement, and then you're going to have to associate yourself with an organization, and that organization being your pharmacy. And some of the things that you'll need ahead of time. So if you're going to do Availity registration, make sure you've got your pharmacy's tax ID number. Make sure you understand you're going to use, you're going to have to put in a primary specialty taxonomy. That's going to be the 1835, 5 zeros and an X, that taxonomy number that is associated with your ability to get reimbursed for NRT and hormonal contraceptives. You will need your organization's MPI number as well as the location of your pharmacy. Once you've input all of that information, then Availity will notify you via email about the status of your approval for your Availity account. They will call you directly if they have questions or if they need additional information, but you will receive an email giving you an update on your status of your account. Once you have your account, it's pretty simple. For Availity Essentials, what we do have available to you is a sample billing instruction guide for both hormonal contraceptives and nicotine replacement therapy for a Healthy Blue member. So this was actually courtesy of Healthy Blue. It will give you step-by-step instructions for how to submit a medical claim through Availity for one of their enrollees. But what I will tell you about this is that there's a standard form that you use for a professional claim. It's called a CMS 1500 or a 837P professional claim. A lot of the information that is required is the same information, whether you're billing for Healthy Blue or some other plan. So you might be able to use what we have here as far as step-by-step instructions for Healthy Blue to help you logistically walk through medical billing for any other claim or plan that might use Availity as well. So I would just throw that out there, is that once you become accustomed to using Availity system, a lot of times the claim processing is just going to be a matter of choosing the payer from a drop-down selection, and then the form that pops up is going to require a lot of the same information. All of those CMS codes that we were talking about, the CPT codes, the diagnoses codes, the modifier codes. So we have this instruction guide on our website. Again, I've given you the link there. And then we also talked about that one of the other methodologies might be that a plan requires that you use their individual portal in order to bill. What we know currently is that there is one standard plan and one tailored plan that requires you to use their portal. United Healthcare is one of those plans, the standard plan. And then Alliance Health is also the tailored plan that requires you to use their portal. Again, pharmacist activation is required. You have to set up an account with them to access their portal. And we have instructions for how you do that for UHC. United Healthcare has another very, very nice step-by-step billing guide for submitting a claim. It also covers how do you create an account in their portal. But they also provide a very nice interactive toolkit that you can actually click on and see videos. It'll walk you through the process for submitting that CMS professional claim. This is also on our website under submitting a medical claim for United Healthcare. I've given you the link there. And then Alliance has a very similar billing guide. So again, step-by-step instructions for submitting a medical claim, getting access to their provider portal. So should you have enrollees that are part of Alliance or United Healthcare, you're going to go directly to their provider portal in order to bill. So who's missing? Well, all right. So tonight I've actually covered the available information I know for 7 out of the 10 Medicaid plans. And unfortunately, we still have uncertainties regarding these 3 plans. So for AmeriHealth Caritas, for WellCare, and for VIA, there's just some outstanding information. I did not feel comfortable providing you with what I had because at this point, what we know is that it would not allow pharmacists to appropriately bill through any of their portals. For instance, WellCare and VIA, they require a provider contract to bill through their portals. AmeriHealth and WellCare say they both use Availity, but unfortunately, the only way you can bill a claim through Availity is through batch claim submission, which most pharmacies do not have the software to do that. And I don't want to get ahead of the game. I just want to share with you that we know what some of the barriers are to billing for these plans right now. And what I can tell you is that we are in the process and we're still continuing to kind of engage with these plans to figure out what is going to be the pharmacist billing mechanism. And then, of course, once we have those details, we will get those on our website for you so that you'll have those at your disposal. But right now, these are the 3 plans that I can't give you further guidance on for various reasons. So I kind of put this slide up here, and this was actually something that Jerry McKee said we should do, is just tell people, hey, just do it. Follow the mantra for the Nike Fortune 500 company and set yourself up for success in 2025. Embrace these new billing authorities that we have for pharmacists, for hormonal contraceptions and nicotine replacement, and just showcase your enthusiasm to seek this opportunity for both financial and professional growth. In a nutshell, create your NPI number and your NCID account to access Medicaid's provider portal. Do it so you can enroll as a Medicaid provider. Check your patient's eligibility and the plan details, and then to bill for any services for a North Carolina Medicaid direct member. Complete Medicaid's OPR Lite provider enrollment application. Get your provider status. Do it so you can use the statewide protocols and bill for those services for Medicaid members, but more important, so that you can get paid for not only the services, but for the medications that you prescribe underneath those provisions. Create your free account in Availity. do it to simplify the billing process should you come across any Medicaid enrollees that belong to Healthy Blue or to Carolina Complete Health Partners or Trillium. And then lastly, if you have a patient that's part of North Carolina Medicaid United Healthcare Plan, or you operate in a county covered by a particular tailored plan that requires billing through their individual portals, such as Alliance, make sure that you're creating your establishing your user accounts for those plans as well, so that should you encounter patients that are enrolled with those plans, you have a mechanism for billing. I'll leave you with this. We've got you covered. Everything in tonight's presentation that I have gone over thus far is going to be recorded. Tonight's presentation is recorded, but it is also, everything is in our NCAP website. And if you go to our North Carolina Medicaid Enrollment and Billing Guide, you'll see the resource pages with details on how you can access all of these. Under submitting a medical claim, you can see we've got it subdivided up for you based off of Medicaid Direct, the MCO standard plans, and the tailored plans. Any information we have related to understanding medical billing for those specific plans are going to be under those links. And then we've also got our hormonal contraceptive toolkit, our nicotine replacement therapy resource page. Consider these your go-to for anything related to developing clinical services, service model development, when it comes to setting up services for these two provisions in your pharmacy. It has anything from the law to the provisions to documents to patient-facing resources to pharmacist-facing resources to referral information, you name it, other resources. It's chock full of information that you may need or that you can use to develop or create a service model for these provisions in your pharmacy. And then I'd also leave you with this. I've mentioned it several times. I'll continue to mention it. But if you're going to offer hormonal contraceptive or NRT services in your pharmacies, you need to let people know what you're doing. And we have a website for that. NCAP developed in May of this year, the North Carolina Pharmacy Locator website. This is going to be the premier resource for patients and healthcare providers alike to find pharmacies across our state that provide enhanced services. If you do not know your login or your password that's necessary for you to access your account in this website so that you can go in and update your profile and showcase and check off all the services that you provide, then contact me. I've put my email address in here. I'll be glad to get you that information. It would have been sent out automatically to your pharmacy's facility email address. I realize some of you may never have seen it. Perhaps you have forgotten about it, but we can certainly generate that for you again. We can get you what you need to log into your profile and make those updates. So again, I stress, if you are providing any kind of enhanced services and you want people to know that you're doing it, make sure that you have updated your North Carolina Pharmacy Locator profile. And then I want to leave you with next steps, because here's where I'm not sure where to go. We could go a lot of different avenues, but I think for next steps, we really need you. We need to know what you need. We've talked about the provisions. We've talked about the protocols. We've talked about service development. We've talked about billing. What else do you need to feel confident and effective in your ability to provide these services moving forward in the future and into the new year? That's what we want to focus and stress our attention towards in 2025, is bringing you what you need. It could come in the way of a panel discussion for those that have already adopted services that can provide, insight and experience. I don't know what that looks like, but what I do ask is that, if you know what that is, if you think of something right now, put it in the chat. Let us know what your thoughts are so that we can start to brainstorm and think about what our next steps are moving forward into the new year. I think we're about right on time. We're at 6:47. And so I wanted to be able to open it up to questions. Again, if you have questions, feel free to put them in the chat. I'm going to stop sharing. Should I stop sharing? Maybe I shouldn't, in case we need to go back to a slide. So you might have any questions I may not be able to answer them. But I would do my best.
Cheryl says anything in the works for CPPs who are not vaccinators to bill for NRT.
Well, unfortunately, CPPs can definitely provide these services if they're working in a clinic environment or in a clinic pharmacy, or a clinic pharmacy, I guess yeah. They can associate this taxonomy number, but they would have to be working in one of the taxonomies that is covered for billing in the pharmacy. So whether it was clinic pharmacy, retail, or chain, long-term care, community, they would also have to have, I mean, that's a requirement of Medicaid. The vaccinator status is part of the law. It's part of the provision. So there would not be any workaround for that. Pharmacists or CPPs would have to get that vaccinator training and certification. I have not heard that Medicaid is altering that in any respect for CPPs.
Then there's another one says, so there's the $100 application fee, any other fees for renewal or otherwise?
There are no other, there's a renewal fee, but that's only every 5 years. Now, having said that, there's not a fee associated with it, but you will receive notification every year, starting somewhere around probably 60 days prior to the end of the year, that will ask you for you to go in and update your license. You know, obviously your license is renewed every year. So about 60 days beforehand, you'll probably receive something from Medicaid saying, go to your manage and change request option to get into your profile and kind of correct your licensure update. But there's no charge for that, but you do have to re-enroll every 5 years. Other than that, I know of no other fees.
Then there's another one. If HC consultation results in a referral recommendation, can I still bill for this visit?
Yeah, there actually is a code that was added to the hormonal contraception that allowed for pharmacists to bill if they were to assess a patient and found that that patient was not eligible for something they could provide, but they needed to refer that patient on, they could actually bill for that. And there is a code for the assessment without product.
Then there was another one. It says, thank you, Cheryl, for pioneering this work. Are you able to share pharmacies that are early adopters or are willing to embrace providing these services in a non-academic or hospital affiliated clinic?
I can check with the pharmacies that we know are either in a pilot looking at this right now, working with us, or those that we know have billed claims, to see if they would be open to being champions for the cause. I'm sure they would. I don't want to mention them right off the bat because some of them actually may be on the call tonight, unless they just want to say, yeah, I'm out here, I've done it, here, call me. But yes, I think what we could do is, and again, this kind of came down to that thought about, do we have another, moving forward, do we do like a panel experience with folks that have done this work and are being successful at it, and can they champion and help others to start? So yeah, I think the answer to that question is yes. And we would use our website under medical billing to probably promote those champions. But if you're, I don't know, Caroline, if you want to reach out to me specifically, I could probably give you a name of somebody that you could call that I know has been doing some work. But yes, the answer to that, I think, is yes. We need our champions and our early adopters to help us. Jerry's got any idea what other scope of practice enhancements that can be billable that NCAP is pushing for? Is Penny on the call?
Let me
I
see.
mean,
I
I
don't
can
think
tell you we're
so.
going, NCAP is working on legislation for, oh my gosh, help me out, Jennifer. I suddenly lost my train of thought. What are
As
we're
far as like
working?
collaborative practice or
No, it's not collaborative practice. It's oh, I'm sorry, Jerry. I'm drawing a blank, probably because of the time of the night and the fact that it's the Sunday evening. And I'm sorry, but yes, we have legislation in the works, and certainly, it's our hope that we can foster maybe getting long-acting injectable administration covered. Test and treat. Thank you, Vera. Thank you, Vera. Thank you, Vera. We have legislation that we're working on for test and treat, which has a payment component tied to it. So yes, definitely.